Hello, everyone, and welcome. I'm Charles Bass, Senior Director of Alumni Relations at USD, and happy to have you with us today or watching this via recording. This program is a co-presentation of the USD Alumni Association and the university's Urgent Challenges Collective, and we're happy you're here with us today. The program will be recorded and available on the Alumni Association's YouTube channel very soon. This is a chance to remind you that many of the more than 260 programs that we have produced during the pandemic are also available on the Alumni Association's YouTube channel. We're grateful for our partners and for you, our attendees. We also want to take a moment to acknowledge that these are some surreal times, and we, with all that's going on in the world, we offer our hopes and prayers for you and your loved ones. A very special thank you to today's program sponsor, Mary McKenzie. Mary is a lecturer in USD's Political Science Department and a 2007 graduate of the USD School of Law. Mary, I know you're listening in, and your generosity and kindness are incredibly appreciated. Thank you for supporting today's program and for supporting the university's Urgent Challenges Collective. With that, let's get started. I do want to remind you to utilize the Q&A feature for questions for our panelists. And I am honored to call them my colleagues. They'll be sharing information about the good work they are doing with the Urgent Challenges Collective. Our speakers today, Mike Williams and Kate DeConick. Mike graduated from USD in 1992 and has been teaching at USD since 1999. He's a professor in the Department of Political Science and International Relations and is director of the Changemaker Hub. He has a PhD from the University of Wisconsin-Madison in political science and a JD from Washington College of Law at the American University. And Dr. Kate DeConick teaches in the Department of Theology and Religious Studies at USD. She is trained as an anthropologist of religion and specializes in the role that religion plays in the wake of mass tragedies, such as 9/11 and the Sandy Hook Elementary School shooting. For the past 2 years, she has also served as co-director of USD's Urgent Challenges Collective and the Homelessness Initiative, which supports research, teaching, and advocacy on the issue of homelessness. Dr. DeConick designs and oversees the collective's programs and has also participated in research studies on topics such as stigmatization and homelessness, perceptions of affordable housing, and currently mourning, grief, and homelessness. Together, Mike, Kate, their support team, and students head up USD's Urgent Challenges Collective, which funds and supports engaged, interdisciplinary, and actionable research related to homelessness and affordable housing in San Diego. Through analyzing the realities of these issues, we lay the foundation for systemic and sustainable change. Mike and Kate, we're very happy to have you with us today, and I will now turn the program over to Professor Mike Williams.
Hi, everyone. Charles, thank you so much for that introduction, and thank you so much for inviting us to be a part of this today. This is super, super exciting. And Dr. Mary McKenzie, I know you're out there, and I just want to echo what Charles said. You've been such a great colleague, a great friend to the Department of Political Science and International Relations, and now your support of the Urgent Challenges Collective is so appreciated. It's going to go directly into our programs in the fall. So thank you so much for that support. So we're excited to be here to tell you about a little bit about an initiative that we've been working on for about 2 years that is called the Urgent Challenges Collective. And I'm going to share my screen here. Okay. So as Charles mentioned, I've been at USD as a student and as a professor for quite a long time. And for the past 7 years, I've been director of the Changemaker Hub. The work that we're doing at the collective, for me, aligns with what we've been trying to do at the hub for the last 7 to 10 years as well. The collective came about through a funding opportunity through USD, through a strategic initiative proposal where faculty, students, and staff can put together ideas about a project that they think the university should be working on. I'd been involved in discussions around homelessness for a few years before Kate and I applied for this grant. And it became obvious to me the more I learned about the issue of homelessness, of how important it was to our community. San Diego County has the fourth largest homelessness population in the country. We have many students who are housing insecure and food insecure. It's all around our community. And we decided we wanted to try to lift up an initiative that would address this issue. And the collective is the outgrowth of that vision. And it's been something we've been developing, as I said, for the last 2 years. And what we've tried to do is we've tried to set up an entity that kind of has like 3 different pillars. It has a research arm, a teaching arm, and an advocacy engagement arm. And all of you as alums of USD, you know that this is what USD is really good at. We're really good at teaching, we're really good at advocacy, and we're really good at research. And we're trying to use those skills of our faculty and our students and our staff to address this issue. So we have experimented the last couple of years with different types of research projects. Through these research projects, we have learned about issues related to homelessness, and we have worked with community partners. And those community partners then, give us advice on these are the issues that you should be talking about in your classes. And then Kate and I have offered a class on homelessness where we had 25 to 30 students studying homelessness with us. A number of those students get really fired up about the issue. They then want to join a research team with us the next semester. We are then doing things in the community around awareness and action, continuing to work with community partners. And we like to think of this as creating kind of like a cycle of the more we learn, the more we teach the students, the more students get involved, the more we go back to our community partners and dialogue with them, grow our community partners. Just the more we can do this work in an organic way and in a way that is going to have real world benefits for our students and for those who are experiencing homelessness. So with that, I want to just briefly tell you about one project that we have been involved in, and that we want to share with you a product of that research project. It was the fall before COVID hit, and it was myself and Kate and another colleague from the Department of Communication Studies, Dr. Jillian Tullis, and 3 undergraduate students. We got a grant through the Humanities Center to start a project on stigmatization and homelessness. And what we wanted to look at was, what are the perceptions that people have about those experiencing homelessness? So Dr. Tullis looked at media accounts of how those experiencing homelessness were framed in the media. Kate talked to religious faith leaders about how they frame and talk about homelessness and think about homelessness through their congregations. I spoke to elected officials in San Diego County. And then Kate and I also talked to those individuals who have either were currently experiencing homelessness or had in the past. And we wanted to just get some ideas about what sorts of attitudes do people have about those experiencing homelessness, and how do those experiencing homelessness, how do they feel those attitudes? And we were able to get some additional funding to keep this going through COVID and get the research done. And it had resulted in a report that we have presented throughout different organizations throughout the city, to different elected officials, different church officials. And our hope coming out of this was that we could actually have people think critically about the language they're using when they speak of those who are experiencing homelessness, to have a better understanding about the real life experiences of those who are experiencing homelessness, and that we could start to switch the perception of the attitudes that individuals have. And we believe that from a policy standpoint, this is critical, right? If we're going to be at a place where we're going to actually change some policies, change some rules about this issue, we need to also be simultaneously changing attitudes on the issue as well. And this research really helped us inform what we could understand about this issue. And one of our products from this, as I said, was a report, but also the more actionable product was an actual toolkit that Kate's going to talk with you about that right now. I'm going to stop sharing, Kate.
Wonderful. Well, it's so great to be here with all of you today. And thank you for taking the time to come and learn about the project that we've been working on. And we're hoping to leave you with some ideas also for how you might take some of the work that we've done and maybe share it out with your own communities, your own volunteer groups, your own church groups, or other organizations that you're affiliated with as well. So as Mike was saying, all of the work that we try and do through the Urgent Challenges Collective is meant to be actionable. It's meant to be useful. It's not just research for the sake of research, right? And so what we want to spend the rest of our time with you looking at today is this toolkit that Mike was just mentioning that emerged from our team's kind of collaborative effort on this project about stigmatization. So I put the link in the chat for those of you who have the chat window open. If you want to open it up and look at the full toolkit, you can access it there yourselves. And I'm going to walk us through just some of the parts of the toolkit. Mike and I have actually done a number of workshops with different religious communities, nonprofit organizations, and other groups across San Diego to kind of utilize the toolkit with them during a workshop. We don't have quite enough time to do a full workshop, and we know some of you are just going to be here for part of the time or watching this later. So we're going to kind of present some parts of the toolkit and what we're kind of hoping to achieve in the way that we've crafted it. And our hope is that even if you're not here in San Diego, there might be parts of this that you could think about creatively if you're interested in how to share either some of the narratives or some of the other information that comes out of this toolkit with your own community. Okay. So this is just like a little sample. And if you're interested in finding out more about the workshops that we host, you're welcome to reach out to us to learn more about those too. Okay, so if we take a look at the toolkit, there's a few versions of the toolkit that we've actually created. We created one for student groups. The one we're going to look at today is a little bit more general. It's for volunteer groups in general. We're also working with the School of Nursing to create a separate toolkit with them that they'll be able to use specific to nursing. So this is something that's kind of taken on a few different forms, but we're going to look at this one version and parts of it today. Okay. So the toolkit, the way that we structured it, the first part is just an introduction. You know, imagine you're part of a volunteer organization that is perhaps interested in the issue of homelessness, but doesn't really know anything about it, right? And you're not really sure where to start or how to get some basic information. The first page just includes some basics about the realities of homelessness. And in this case, it's centered around San Diego because that's the community that we were studying and kind of working with, but this could be adapted for other communities as well. So pointing out just the sheer number of people experiencing homelessness in our county, more than 7,600 people were documented in the last point in time count. This is the annual attempt to get at least a rough estimate of the minimum number of people who are experiencing homelessness in San Diego County. So with the point in time count, what happens across San Diego is on one day at the same period of time in January, a whole army of volunteers goes out and tries to, at one snapshot in one moment in time, capture the numbers of people who can be found either unsheltered or in shelters, right? So it's not a perfect count because you don't necessarily count everybody who's out there. It's just the people who the volunteers come across. So in 2019, which was, or 2019, yeah, 2019, 2020, 2020 was the most recent count. It was canceled this past year because of COVID in January, but we had 7,619 people who were counted, right? So a huge number here, huge numbers in many cities across the United States and really across the world. And the way that we frame the initial part of this toolkit is just recognizing that there are a lot of assumptions that people hear or might even personally have about this issue of homelessness, right? When we talk to our students or we talk to community partners and we ask them, you know, when you first think of those who are unsheltered or unhoused, what are some of the thoughts that come to mind? Those of them who are honest with us will say things like, well, you know, my parents tell me those folks just need to get a job, right? They just need to work harder. They need to pull themselves up by the bootstraps. Where there are sometimes a lot of assumptions about, you know, how everyone who's unsheltered is mentally ill or suffers from substance abuse, right? So there's a lot of perceptions that people hold about those who are experiencing homelessness here in San Diego, but also more broadly. So we kind of talk to people a little bit about that. And then we follow it up with what are some of the realities, right? And the bottom paragraph on this first page goes into some of the statistics and some of the information that we know, right? So one other common misperception is that a lot of people believe that people move to San Diego to be homeless here because the weather is so beautiful and it's such a beautiful city to live in. That's not the reality, though. The reality here in San Diego is that 80% of those who become homeless in San Diego are people who were already living here, right? So it's our neighbors, it's people who you might know who are struggling and you just don't realize it, right? So we lay out some of the realities about that. We also think about some of the racial disparities that we see within the population of those experiencing homelessness. Just one example of that. Black individuals make up about 4.7% of our general population here in San Diego County, but 21% of the unsheltered population, right? So our systems and our structures and the way that things work are creating the conditions under which people are becoming unsheltered, right? So we're kind of giving all of this as context, also talking about the lack of affordable housing here in San Diego is another major issue, okay? So you're welcome to kind of read through this at your own pace, kind of independently, and see what else strikes you on your own. But I'm going to kind of keep moving through some of the other parts of the toolkit with you. Okay. So the next part of the toolkit introduces people to the idea of stigma. Stigma is something that can take many different forms. It's often kind of associated with stereotyping, but it can also be a mentality of separating oneself from others, a kind of us versus them mentality, labeling or status loss, discrimination. These can be all different forms of stigma and the way that it comes to life. And so what we explain to groups when they do the workshop and what they see if they read this independently is that this toolkit is really centered around what is stigma, in San Diego in terms of homelessness. What does it actually look like? What are the experiences of stigma? And what are the consequences of it? How does this actually impact the realities for those who are experiencing homelessness, but also for us as a broader kind of community here in San Diego? And as Mike was saying earlier, we explain a little bit about who we talk to and why. Right. So if you look on the bottom here, you'll see some of the takeaways that we heard from the interviews with folks who are actually unhoused or unsheltered here in San Diego. So some people talking about the ways in which they were turned away from places like restaurants or other sites due to the way that they physically looked, kind of assumptions being made about who they were or feeling like others perceived them as dirty or unworthy or simply invisible, right? This tendency to not even make eye contact or recognize those in our community who are suffering tremendously if they're unsheltered. A lot of people described being treated as kind of disposable. And other people who might have been couch surfing, living out of a car, or even unsheltered, mentioned to us in their interviews that they were really hesitant, even if they were working, even if they were going to school or had other kind of networks that they were part of, they were really hesitant to open up to people who they knew and cared about even about what they were going through because of the stigma surrounding homelessness, right? There could have actually been support networks that people could have drawn from, but stigma was such a barrier. They didn't want people to kind of look down upon them. So we talked to at least a few folks who were like students, full-time students going to college at the time who didn't open up to their professors, right? And you can think about the consequences of trying to navigate, higher education is hard enough as it is, but trying to navigate that while you're unsheltered and worried about where you're going to sleep that night or, where your next meal is going to come from, that burden is tremendously heavy, right? So we talked about all sorts of other kind of consequences here, including the fact that, some folks even feel that stigma when they're going to work with case managers or social support services that otherwise might be able to serve them. So really just laying out for people, stigma is an important issue, and let's start to think about what are the consequences of it. Okay. All right, so if we were doing this as an actual workshop, what we would do next with the groups is we would just give them a little bit of space to step back and think about what are some of the things that they have kind of heard about homelessness, or what are some of the questions or initial reactions that they had when thinking about this topic, giving that space for a little bit of self-reflection before we kind of go into some accounts and some analysis and discussion questions together as a group. So some of the things we'll commonly hear from people are things like what I had mentioned to you previously, this assumption that those who are unhoused are lazy, about substance abuse, about mental illness, that these are people who are dirty or in other ways kind of unworthy, is sort of the undercurrent of a lot of what we hear about the initial assumptions that people might have. So I think, Mike, I'm going to turn it over to you next, and you can kind of talk to people a little bit about the next part of the toolkit and introduce them to one of the narratives here.
Yeah, thank you. Yeah, so the next part of the toolkit, we actually draw from some of the interviews that we did with those experiencing homelessness. And we share a little bit about their story, and we just have our student groups or our volunteer groups just read the account and then just talk with one another about what this account raises up in them. What assumptions kind of rise up, or what questions do they have, or what's something they learned. And I just want to say that, as I mentioned, Kate and I started doing our interviews specifically with those experiencing homelessness after the pandemic hit, after everything was kind of shut down. And we talked to over 20 people over a few months, and it was the most impactful and the most draining part of the research project was to get on a Zoom call with someone in the midst of the pandemic and talk to them about their life as they were living out of their car, or they were just getting housing, or whatever their story was. So I just wanted to give that context of that's where these accounts come from. And I'm just going to read this first account and then just kind of point out to you a couple of things that come to mind as I think about this interview. So this account reads, when my daughter was sick with cancer and we lost our home trying to pay the medical bills, we spent a lot of nights sleeping in our car. The police were always telling me I had to move the car, that I couldn't be parked there. The people who treated me the worst were the police. They used to be so mean. They would treat you like you were nothing. What else were we supposed to do? We were homeless. We couldn't go inside somewhere. We couldn't get food. And that's from a woman we're calling Jasmine. Her office identity is anonymous, who's a 40-year-old Black woman who, after we had talked to her, she had been able to find housing. And for me, what that raised up in me immediately is that I too have some assumptions about who is on the streets, who's living on the streets, and what their conditions are. And to make the connection between someone getting sick and being one medical payment away from losing their home, to not even that person who is maybe the adult in the family, but it was a young child here who was sick, and then having to take care of a sick person, whether it's a child or an adult, while living in your car or living on the sidewalk. We talked to a lot of people about other accounts about just the difficulty of getting the bus money to get up to where their doctor's appointments were for their different treatments. This account also raises in me the notion of the police. And Kate and I are right now involved in a different research project, talking to individuals about their encounters with the police and looking at public records data of the thousands of citations that are given each year to people for living in their cars, because it's illegal to live in your car in San Diego. And then finally, just to highlight what Kate said a moment ago, the great disproportionality in terms of Black residents in San Diego, in terms of their population, in terms of the impact that homelessness has on them. And this came very much through as we were reaching out with our different community partners to do these interviews. And it really has woken me up as I'm just driving around different areas of San Diego. If you're looking for it, you can definitely see it, right? You can see that there are a disproportionate number of people of color who are experiencing homelessness. And that's what that account raises in me as well. Kate, I don't know if you wanted to add anything about that particular account as well.
No, I thought that was really helpful, Mike. No, I think if it sounds good to you, I'll move on to the next account as another one that people could kind of think about in terms of our framing of the toolkit. Okay. So yeah, what we did is, we paired these accounts also just with some conversation starter questions, right? We tried to really make space for people to come at all of these different stories in different ways. So that's where you see the bullet points underneath each of the stories, is just giving opportunities for people during the workshops or during, sessions with their organization to kind of talk through like what comes up for you when you read this. So we have two other accounts that we also pulled, and different versions of our toolkit might sometimes use different narratives as well, depending on the target audience. The toolkit that we're working to develop with the School of Nursing is going to have a lot more to do with kind of health-related issues. But for the general volunteer toolkit that we're looking at today, I'm going to look at account number 2 with you. Okay, so this one is from Gabriel, the person we're calling Gabriel, who was not currently housed when we interviewed him, 58-year-old Mexican-American man. And this is what he had to say. He said, "Drugs have been a big downfall in my life. I've spent most of my life locked up for doing crime and doing drugs, but I've never been homeless until recently. Because I was incarcerated for most of my life, I never got to experience all the normal things people experience. So life for me was very complicated. Me and my friend lost our apartment when I was 52. We had a couple of roommates that moved out on us. I tried to pay rent, but it was too much for me, so we turned in our keys and went to the streets. I think a lot of people this day and age don't care and are very quick to give their judgment. They look down on us like we are a piece of trash. They don't know how we live or how we got to where we are at. Nobody wants to be homeless. The church that my girlfriend and I attend is the only place that showed us love, unconditional love." Okay. Yeah, so looking at this account, this is going to bring up different things for different people. And one of the things that we did want to acknowledge is that, the realities of substance abuse are there at times, right, within the unsheltered or unhoused population. And for some folks, it's substance abuse that might lead them partly to their conditions of being unsheltered. And for other folks, not as prevalent in this story, but for other folks, the reality is that the conditions of living on the streets, right, the intense experience of suffering that people have can actually lead them to start using substances as well, right? So it's sometimes this really unfortunate reinforcing cycle of when you're so depressed about what your everyday reality looks like, and you're struggling, you don't seem to make any progress. Sometimes substances do serve as a sort of outlet, whether it's something that most of us think of as a healthy outlet or not is a different question, right? But the questions that we put for groups to think about here are encouraging people to start thinking about the ways in which issues like homelessness are intersectional, right? So thinking about how does, the criminal justice system and mass incarceration intersect with the realities of homelessness, right? A lot of the folks who we talked to who had a criminal record or who had been in prison for a number of years left, being in the prison system and didn't have any sort of support system or a way to kind of rebuild their lives afterward. And so, whether or not we think of these folks as kind of deserving, right, which is something that the second question is getting at, the reality is that our systems are not creating the possibilities for certain people to kind of put their lives back together, even if they're hoping to, right? And the second question I do think is a very important one, especially as we think about Gabriel's comments about how the church was an organization or a place that showed love and unconditional love, right? One of the things that Mike and I thought a lot about in the context of this project was that we live in a culture that tends to think of notions of some people are deserving of housing and other people are not, right? Or deserving of support and other people are not. And so starting to think about how might we be able to shift that mentality. We're a very kind of capitalist, pull yourselves up by the bootstraps kind of society, but that is also a mentality that can lead to tremendous suffering if we're thinking in punitive ways about you don't deserve housing. It's not that way in all parts of the world today, right? So these are just a few of the things that come up, at least for me, when I think about the second account. Mike, I'm not sure if there's anything you'd like to add to that one or if you want to keep moving from there.
No, I think we can keep moving. Do we have time for the third account?
I think we do. So I would say to go for it.
Okay. So this third account focuses on the comments of Amy, a 24-year-old white woman who was currently housed. And she says, as a child, other parents wouldn't allow their children to be near me because my mom and I lived in our car. They were afraid that I was like infected with the disease of homelessness. Really, when it comes down to it, in San Diego, there is so much judgment and so much stigma around being homeless that it is common to want to appear as if you are not homeless. The LGBTQ Center in San Diego has been of great assistance, not only for me, but for my friends. I felt that I could use their space and nobody was going to judge me. That's really what I needed. So for many of our students at USD, youth homelessness is maybe the issue that they are most interested in thinking about and talking about. And so this account we think is important because it shows not only the attitudes of someone, a youth who is homeless, but it also gets at another important issue, which is that the experience of homelessness, oftentimes that negative experience continues to affect individuals once they have been housed. Their own feelings of self-worth are damaged by the stigma that they faced while living on the streets. And in San Diego, there has been, it's one of the big policy pushes to actually end youth homelessness. This is an issue within the community that is working on this, that there's a huge belief that this can be accomplished and that it should be accomplished because of the long-term effect that it has on individuals, even after they are able to find housing. So for many of our students or the friends of our students, they may not identify an experience they have had as being homeless, but technically speaking, if you are couch surfing, or if summertime comes and you're not sure you have a place to stay and you don't have a place to stay, you are an individual who is experiencing a type of homelessness. And so this account is just, it's important because I think it demonstrates the vulnerability of children and the challenges of addressing this so that it doesn't have the long-term impacts.
Awesome. Thank you for framing that for us, Mike. Yeah, so there's so much we could talk about in relation to any of these accounts, but as you can see, like the point here is just to get people thinking and to get them talking about elements or dynamics related to homelessness that might not be the first things that immediately come to mind for different people when they think about this issue. So just to move on a little bit from there, we wanted to just wrap up showing you a couple parts of the toolkit. And then we also wanted to end our formal presentation part just by giving you some ideas for ways that you can get involved if you're interested. So the way that we frame this in the toolkit itself is we kind of conclude by drawing a distinction between charitable ways that people can kind of become involved in the issue of homelessness and ways that they can also do justice work. And just to explain a little bit about what we mean by this, charity and justice are both really important responses to homelessness as an issue. When we're talking about the idea of charity, we're talking about things and types of donations or support that meet the immediate needs of a person or a group that is currently in crisis, right? So if someone doesn't have a meal tonight, right? If someone doesn't have clothes to wear or a place to stay, you know, at this present moment, providing those sorts of things, making donations, right? Dropping off food, right? There's a great organization in downtown San Diego called Rachel's Night Shelter that University Ministry visits every semester, and we drop off meals, right? We create meals and we drop them off at the shelter to meet those immediate needs of people who need food, right? There's many other organizations who do similar work here in San Diego. That is important. You're helping people literally survive in the present moment, right? So that is certainly one way to get involved, right? Is to do that kind of charitable work. We do encourage people, and we especially encourage usually our student groups to think about, though, you know, if you want to make a charitable donation, it is super important to talk either with the people or the organization that you want to make that donation to about what do they actually need. And we've heard from so many wonderful, gracious community partners here in San Diego, like, yeah, they always appreciate whatever people bring to them. But, sometimes people will drop off 500 toothbrushes, and that's not what they need right now. They have a whole supply of toothbrushes, right? Maybe it's socks, maybe it's blankets, right? So we just always encourage people to think not only about what you want to give, but also what do the people who you're trying to serve actually need in that particular moment in time. Okay. So that's kind of one framing or one way of thinking about charity. Justice work, on the other hand, involves kind of working to support systemic change, right? Working on creating policies or voting or doing things that are going to get to the root causes of poverty and discrimination and other issues that are resulting in homelessness as kind of this widespread phenomenon here in San Diego, but also elsewhere. And so we encourage people just to remember, this doesn't have to be like you need to run a whole campaign by yourself, right? Sometimes it's just showing up to your local city council meetings, right, which are open to all people here in San Diego, and educating yourself about ballot measures and what are the implications of those ballot measures for these communities and for others, right? So really thinking about engaged and kind of responsible citizenship as a super important response to this issue as well. And that we kind of end this part of things just also by saying sometimes it's even just making small changes in your everyday life that can promote this justice work. So for example, if you look through our toolkit, we never use language that reinforces kind of stigmatization of homelessness. We always use person-centered language. We always talk about people experiencing homelessness, for example, as opposed to saying like the homeless, right? So sometimes even just making intentional changes about the way that you talk about an issue, that is one meaningful way of contributing to justice work. And then the final part of our toolkit is a kind of list of some additional resources for people who want to learn more. There are some great podcasts. There are other materials that we've posted on our own website with the Urgent Challenges Collective. Our resource page has all sorts of updated news articles, local reports, volunteer opportunities. So this is kind of where we leave people who want to kind of do more with their group. And Mike, maybe I'll just leave this up as you talk people through a kind of few final ways that they might get involved that we wanted to share for today.
Yeah, great. And then we'll get to the questions. Yeah, as Kay was just saying, there are ways that you can get involved either with us or with the issue more generally. So we just came up with 4 ideas, right? And one way is just to look into your own community and see what's going on around the issue of homelessness. I live in the community of La Mesa, and La Mesa just recently passed its first homelessness action plan. Of the almost 20 jurisdictions within San Diego County, only a handful even have policy action plans about how to address the issue that is obviously a huge regional issue. So learning about what's going on in your city or county, attending those meetings. I've learned last year that making a public comment at a city council meeting, it does matter when it's one of 20 different comments coming in. It helps the elected officials know kind of what's important to constituents. So that would be the first kind of like maybe the most critical maybe, but also the easiest way to just get involved in your local community. Also, we really want you to use this toolkit with your community groups, with your church, within your schools. You're welcome to download it, to use a version of it, and to engage in conversations with your friends around this issue using the toolkit itself. Third, if you have a particular interest or relevant experience around the issue of homelessness, please reach out to Kate and I. This summer, we're going to be planning our events for next year, and we would love to bring you into an event that you have some relevant experience, or if you have an interest in being involved. For example, in the midst of doing this work this last year, we reached out to 2 different organizations here in San Diego, and as it turns out, both of them are being led by alums of USD. So now we're working with community partners, and we're working with some wonderful alumni. So please let us know if you have that kind of interest. And then finally, if you would like to make a gift to the Urgent Challenges Collective to continue to support the work we are doing, the programs of the research, the teaching, and the advocacy, you can do that. That would be much, much appreciated for your support. We're in the midst of kind of gearing up our fundraising and our grant writing for this next year as our internal funding is kind of running out. So those are some specific ways that you could continue to be involved and to support the work. So thank you.
Hello, everyone. Thank you so much, Mike and Kate. What a wonderful presentation. And Charles mentioned at the beginning of the session that he was honored to call you both colleagues, and I echo that sentiment. I'm very proud to be Toreros with you both. For those of you who don't know me, my name is Kara Marsh-Prophet. I'm the Director of Alumni Operations and Engagement with the Central Alumni Team in the Alumni Association. Work very closely with Charles, who had to jet out, so I am covering Q&A today. We did have a question asked through registration, so I'll start with that, and then we've got a couple questions asked in the Q&A feature, which you guys can check out and kind of look at in a minute, and I'll certainly just vocalize that as well if you'd rather. So we'll start with the first question that was asked during registration, and this was asked by today's sponsor, Mary McKenzie. Have you sensed or learned about any changes since Mayor Todd Gloria and the new City Council took office and or the Board of Supervisors? So I guess we should start by recognizing that Todd Gloria is a fellow USD graduate. So very proud.
Department of Political Science.
That's right.
Right.
So what do you guys think? Any updates now that Todd has taken office?
Kate, do you want to start?
No, I'm going to let you start from your political science background, and then I'm going to fill in from there.
Okay. Yeah, it's a great question. And I think that the tone, what Mayor Gloria brings is a different tone, a different language he's using when he's talking about those experiencing homelessness. He talks a lot about compassion, a lot about dignity. And not that the former mayor didn't have compassion and dignity about the issue. I think he did. He just did not sort of explicitly use that language in talking about it. So that's the first noticeable difference, is that the tone. And it's every time I see Todd on the news, no matter what the issue is, he's always directing it back to homelessness. So he's trying to keep it as the #1 policy issue as well. Now, in terms of actual policy, it's a bit early in terms of judging what he has been able to do. But I would say, as of right now, I would say it's kind of mixed. There's been some reporting that there are sweeps that are often done. That's how those experiencing homelessness actually describe them, as the sweeps, where the police will come in and move people off certain sections of downtown. That is continued at the same pace as it was during the previous administration. But then there's been new reporting out, and Mayor Gloria has responded to that by saying that he wants to do this in a more compassionate way. He wants to give people more of a heads up, maybe not throw away people's property as that's happening. But he's in a difficult situation, I think, as we come out of a pandemic and as businesses are wanting to open up and people are coming downtown. He's in a difficult policy position. And he knows that the key to addressing homelessness is more housing. It's called the housing first model. And I know he believes in that. And the big sort of question and the big thing he has to do is come up with the funding to actually get that housing available for people so that they don't have to be in shelters and that they can have some permanent housing.
Yeah, and I would just build on what you were saying, Mike, just to explain a little bit more about what housing first means for those who might not be familiar with it. A lot of the models that have existed to kind of serve those who've experienced homelessness in the past have kind of had barriers to receiving certain services. It was to say, you have to be sober for X number of days, you have to meet these different criteria before we'll even kind of talk to you about services, or you'll be eligible for services. And all of the research shows that that model does not work, right? It's really kind of based, as Mike and I were saying before, about this notion of who deserves kind of housing, how you have to earn it when you're in the midst of suffering. The housing first model, which has been really widely adopted across the United States in the past few years, says actually what we need to do first is put people into housing and then provide, in many cases, supportive services at that point to help them work with mental health issues, substance substance abuse, other health concerns or other things that crop up. So housing first, just even having the city being more, or the county being more on board with that model is, I think, a big step forward in terms of meeting people where they're at and doing meaningful work that's going to create change. The only other thing I want to add to what you said, Mike, which was excellent, was just that there was this breaking news yesterday, and I wanted to put just a link to a news article I was looking at this morning, that the city or the county has just announced this new department. It's called the Department of Homeless Solutions and Equitable Communities, that is really meant to kind of decrease this siloing effect that we kind of see in San Diego. And a lot of the homeless advocates who I've talked to across San Diego over the past couple of weeks have honestly been pretty critical of Mayor Gloria, but when they heard about this, they saw this as a huge step forward. So I'm still kind of doing my research about what this department is going to look like and trying to find out more myself. But I think this is something that for those of you who are interested is worth kind of keeping an eye on. So yeah, I think that's all I would add. Great question.
That's great. Thank you. We have a number of questions that have been asked through Q&A. So I think that the housing first model is really interesting. And I'm wondering how, and this is a question from Pam White, who is a fellow colleague of ours, how have increasing housing prices in our city impacted plans for affordable housing, potentially impacting also the housing first model?
Mike and I did a project last year with a group of colleagues at SDSU on perceptions of affordable housing here in San Diego. So we've spent a bit of time thinking about affordable housing as a kind of option, and also some of the pushback to affordable housing that we see in our community. There's this acronym that is sometimes used called NIMBY, right? This idea of not in my backyard. That, yeah, maybe there should be affordable housing for folks who need it, but I don't want it anywhere near me. And so part of the goal of our project was to unpack, like, under what conditions are people comfortable with affordable housing? Because if there's not community support for it, it's really hard to get that passed. Mike, you might have more that you want to add on that point, but the only other thing I would add in response to this question is we're continuing to see a trend in San Diego where there's increasing building, but it tends to be high-end luxury building that's taking place, right? So for people who have $500,000 plus to buy a house in San Diego, there's going to be new properties available. We're not seeing enough affordable housing being built, even though the city plan, for the next 10 years to address homelessness says we need these units. I'm not sure that we're keeping pace with that plan. And this is eventually also going to kind of create a crunch in the middle zone, right? So maybe we're building in the luxury end, and eventually we have more affordable housing for the lower end of the kind of market. But that middle zone, I think we're going to see a lot of people struggling in that kind of mid-range who are looking for housing too. So not my most optimistic prognosis or diagnosis of where things stand, but that's what I'm thinking about here. Mike, did you want to add to that?
Yeah, I just had just two more quick things. It's a great question. And yeah, the cost of housing is definitely a barrier. It's really, really difficult here in San Diego. Unfortunately, some of this is of our own making in terms of past policies. The downtown renovations that have been happening for the last 2 decades. I remember when I was a student at USD, like the downtown was just then starting sort of the redevelopment process, right, with Horton Plaza, and then it was slowly moving out towards the East Village. There were a lot of units in downtown that are called single residency occupancy units. And they're 1-bedroom units, super, super cheap. At the time, they were like $300, rent for a month. It was communal bathrooms. And a lot of people who were just on the verge of being homeless, they would use these, right? This would be their home. What we've done in the past 20 years is we've almost completely gotten rid of all those units as we've developed the downtown. And one of the results of that is the increase in homelessness. So whether we need to rethink, resupplying that stock, or there are government funds available to purchase hotels, right? And I know in my own city, La Mesa, they had an opportunity through a grant from the federal government to purchase a hotel and to turn that into permanent housing. And the residents in La Mesa did not want that to happen, which is why the funding was there. It is a problem in terms of the cost, but in terms of dollars and cents, it's much cheaper for our community in San Diego to build the permanent housing than it is to support the shelters and the other support and all the other things that go along with having people live on the streets. So I don't have a great answer for that, Pam, but that's as close as we can get.
Thank you. Next question is from Sean, a 2020 grad. What should the police be expected to do in light of their responsibilities to enforce laws and to manage legitimate community concerns and rights of business and property owners?
What a great question, Sean. Thank you for this. Mike, do you want to start or do you want me to chime in first? I'll go first. You can build from what I have to say. Yeah, so Mike mentioned that he and I are part of a research team that's currently looking at relationships between those who are unsheltered and law enforcement, and citations as a particular kind of outgrowth of those interactions. And I think, Sean, your question is important because you're highlighting also that as a system, we've created a really difficult situation for law enforcement, right? We have created a system in which people call the police to resolve issues that have to do with those who are unsheltered, especially businesses, right? There aren't a lot of good options for people who don't necessarily want someone to get cited or arrested or forcibly removed from a site, right? If they just want to resolve this kind of ongoing dynamic, if there's someone, for example, who's sleeping in front of their business and they're worried that that's, detracting customers from coming by, the way that our society currently works is people think first, like, let's call the police because they're the ones we turn to for issues like this, right? And I think that puts law enforcement in such a difficult position, right? They are not trained to be working with folks who have the levels of trauma or who carry the sort of experiences that people who are unhoused commonly do, right? So we're asking a lot of them. And there are some kind of programs that are more centered around across the country, trying to think about, can we, instead of having just police responding, could we have trained like mental health clinicians or other folks going out into the community to do some of this work? And in my view, I think that moving toward models that are more about, instead of just punitive, right, like punishing those or expecting that law enforcement is going to know how to do this work in a good and humane way, like we can't ask that of them. So I think that moving more toward a culture of kind of care and a response that is humane is something that as a county, we could really be doing a lot more thinking about. Mike, I'm sure you have thoughts on this too, though.
Yeah, just a couple. I mean, it's such a good question. That was such a good, I think, answer. We're really at a time, given the pandemic and given the racial justice issues that we've been seeing unfold almost the last year, a serious rethinking about what is the role of police and what should the role of police have. I think they are put in a very difficult situation a lot of the times. But again, to me, this comes back also to just looking in your own community and seeing how your own community spends its budget. Most local government communities spend 70% of their budget on law enforcement or fire or something like that. I know in La Mesa, that's what happens. In La Mesa, they just adopted the policy that Kate suggested, where they've hired 2 social workers to be on staff to either go out with police or to go out on their own. And they've created a new hotline to where you don't call the police, you call this hotline if it's a non-dangerous, non-threatening situation, but there's just someone who's experiencing homelessness and they need to be met with. To hire 2 social workers to work part-time was less than hiring 1 police officer. And so in terms of just allocations of budgets, police are necessary, so are social workers. And I think this is really at the local level to think through how should those resources be spent and what are some models that are more effective in terms of outreaching to those experiencing homelessness than we're currently doing.
Great, thank you. The next question is for a fellow alum and a current member of our staff. How do you recommend we talk to our young children about homelessness?
Like, I'm going to let you start because you have a couple little ones at home.
Yeah, bigger. They're 12 now, 12-year-old twins. Such a good question. Maybe it's because I've been doing this research, but I share the stories that I hear with my kids. I also I try to model behavior that I would like them to model. So what we've heard from a lot of individuals that we've interviewed is that people feel invisible. They feel like they could literally just be walked on, like walked over, walked on at the street level. So I make it a real point whenever I am walking by, or oftentimes at a stoplight, whenever there is someone who's experiencing homelessness, I make it a point to look them in the eye and to say hello, and to say, how you doing? And I do that to model to my kids that there's no need to be afraid of someone just because they may be poor and they may not have shelter for the night. That's not a reason to be afraid. And it's definitely not a reason not to just kind of say hello. So I think modeling that behavior, and I think also sharing the wide range of experiences as to why someone might experience homelessness would be good for kids to know. It's not all just about substance abuse or other types of issues. There's a lot of other reasons, and sharing those stories I think would be helpful.
Yeah, I think your point about modeling is super important, Mike, and kids pick up so much on these like little cues that we might not even be aware that we're doing at times. But we've talked with a lot of folks who volunteer with church groups or other things who also just bring their kids along, right? When they're doing, some sort of community meal, or they're doing outreach to the community. And maybe the kids aren't playing an active role, but they're just kind of there to see what their parents are doing and how they're talking and how they're treating people. And I think that's so powerful. Yeah, there's much more we could say about that question, but I think that's a good start at least.
Yeah, certainly. The modeling has been made challenging by recent circumstances with the pandemic, of course, too. And speaking of the pandemic, Jana, a 2013 graduate, has asked, what was a result of the county meeting about the new department? The meeting was dominated by COVID concerns, and Ms. Jana did not hear the conclusion of that.
Yeah, so I don't know all the specifics of how everything played out at the meeting. I wasn't there myself. Mike, you might know more than I do, but my understanding is that the county basically approved this new Department of Homeless Solutions and Equitable Communities, which is meant to kind of, as I said before, break down those silos. So the way that they talk about it in the article that I shared is that it's expected to kind of strengthen collaboration with regional service providers and kind of streamline delivery of services. I don't know exactly what this is going to look like in practice yet. I don't have all the nitty-gritty details, but my understanding is that the new department was kind of approved, which, as I said, is seen as a step in the right direction. Mike, perhaps you know more than I do, but I'm not sure.
Well, I don't know anything more about that specific meeting. I do know that the issue of COVID and the issue of homelessness are so intersecting, right? And I know that the county and different city governments, we're at the verge of possibly seeing a surge of homelessness. There are many people who are right now not being evicted from their homes or apartments because of the eviction moratorium. When that finally goes away, which it eventually will, we're going to see a surge of people who are going to be forced to live on the streets. And I think that this department, in thinking about the COVID world and the post-COVID world, and how to be maybe a little more proactive rather than reactive when we kind of know what's coming down the road, unfortunately. So I would encourage all of us to just kind of think through, as we're getting through COVID, these types of issues and how they might be affecting our communities.
Great. Well, we are at 12 o'clock, you two. Thank you so much for sharing your expertise, for doing this good work, and being willing to share it with our alumni. I do have a ending slide to share with all of our participants here. So this is a thank you to all of you who are listening in today, and for those of you who are watching later on through our YouTube channel. These are our websites, alumni.sandiego.edu and sandiego.edu/homelessness, which I also put in the chat for all of you to be able to click on easily and learn more about the Urgent Challenges Collective and this good work that Mike and Kate are doing. Charles mentioned at the beginning of the program, the Alumni Association pivoted to virtual programming when the pandemic struck. We are sitting at over 260 virtual programs to date, and we are not letting up off the gas. So you can see that just within the next couple of weeks, we've got a lot lined up. There are a lot of opportunities to connect with your alma mater, our alma mater, and with fellow alumni. So do check them out. Check out these events at alumni.sandiego.edu and check out our other virtual offerings, such as our Tiny Torero Storytime podcast, our team mentoring platform, and alumni spotlight interviews and Zoom trips on YouTube. So take good care, everyone. Hopefully you found this session engaging and interesting, and you'll be able to utilize that toolkit in your communities. Have a great day.